Hello everyone. Do all hernia repairs need a mesh? Do we ever do a hernia repair without mesh? Let us see this question today. Before understanding or answering this question, first let us understand why a hernia happens. A hernia happens because there is a weakness in the muscle wall. There is a weakness of the muscle which leads to a gap, and through the gap intestines start protruding out, and that is called a hernia. So when you want to repair a hernia, what do? You close the gap with stitches. And what if the muscle is not strong enough to hold your stitches? You need to use another buttress or another support, which is in the form of a mesh. So a mesh is kept in places where the muscle strength is not reliable. Suppose you stitch the hole with stitches, and after a period of 3 months to 6 months, because the muscle is innately weak, the muscle becomes thinned out and loose, and again the stitches will open out. And these are the times where you would need to reinforce your repair with a prosthesis like a mesh. So does it mean that we put a mesh for all hernias, that we do not do a repair of hernia without a mesh? No. There are certain scenarios where you do not need a mesh to repair a hernia. So what are these conditions? Let us see them one by one. The first one is called congenital hernia, wherein this usually is seen in children or newborn babies, where there is absolutely no defect in the muscle. It is just that the natural windows in the groin, which are usually open for the testis to pass out, usually they close after the birth. If they fail to close, the hole remains open and intestines start protruding out. And this is called a congenital hernia. In these hernias, all that we need to do is put back the intestine which has come back and close the hole with a stitch. Because there is no weakness of muscle involved, you do not need a mesh to repair these hernias. Second, traumatic hernias, meaning if somebody gets an injury, especially like a stab injury in the abdomen, it can pierce through the abdominal wall, and that can cause a hole through which intestine can come out. This is usually an emergency situation, and these conditions there is absolutely no weakness of the muscle wall. It's basically a injury or a trauma or a cut which has caused the muscle to give way, and in these conditions the intestine is just put back and the hernia is repaired using stitches alone in most cases. The third one is very small hernias, especially belly button hernias. See, belly button is a region which usually does not have muscle. It's a natural weak spot. That is a point through which the umbilical cord enters the body, and after the baby is born, that usually is sealed with a scar tissue or a fibrous tissue. In some people, this scar tissue or a thin plugging tissue can become weak and can give rise to a small defect through which intestines can bulge out, and this is called an umbilical hernia. If the person has a good tummy tone, abdominal wall muscle tone, and if the belly button hernia is very small, it can easily be repaired with stitches alone without the use of a mesh. There are times where we have very young people with good muscle tone, where even groin hernias can be repaired without mesh. But these are scenarios which are quite less common than the usual hernia scenarios we see. So in majority of patients, we would require to use a mesh, but not all hernias require a mesh. Like I told you, these are the scenarios where you need not use a mesh to repair a hernia, and a simple repair of the muscle with sutures alone would suffice.